A very good afternoon to one and all. I welcome you all for today's webinar. Today's webinar is titled Cardiovascular Toxicity Linked with the Fluorosis. So today with us, a renowned interventional cardiologist, Dr. Yashwant A. Lakshmaya. And the very purpose of conduct of this webinar is the fluorosis has got a lot of impact in the Kolar district. The fluoride has caused a lot of disease in this local population. Beyond the skeletal fluorosis, we are observing the multi-system disorders with respect to the fluorosis. And we have observed at a very young age, many of the population here are suffering from the diabetes mellitus and also its associated complications, either the microvascular or the macrovascular complications. We have done a lot of studies with respect to the fluorosis in our institution. Even we have linked this fluorosis to the cancer, and we have got a positive results with respect to this one. So the details every month we are sharing it by conduct of the monthly webinar. So the today's topic is fluorosis, its implication on the heart. The very purpose of taking this topic for this month is because of the reason that it has been observed and documented from the medical records of our institution. Our institution is one of the referral center with respect to the Kola district. We have observed that every family here, irrespective of the risk factors, they are suffering from the cardiovascular diseases. This has been documented in our medical records. And in addition to the myocardial infarction, so many other hypertrophic myocardial diseases and various other valvular diseases, particularly in case of children, are also being contributed for these things. However, the molecular studies are required to say that exactly it is the fluorosis that is the root cause for all these things. However, we are into this research, and shortly we are going to bring about a dossier about these things. So with this brief introduction about the today's topic, the details of which Dr. Yashwant Lakshmaya will be taking it further. And I am proud to introduce Dr. Yashwant A. Lakshmaya, who is an alumni of our institution. Dr. Yashwant Lakshmaya, to his credit, he has got many awards and medals. He has secured gold medal in the undergraduate as well as in the super specialty DM cardiology. He has done both undergraduation and post-graduation in our institution, Sri Devarajaras Medical College, which is affiliated to Sri Devarajaras Academy of Higher Education and Research. He did his DM cardiology from Amrita Institute of Medical Sciences. He has got a lot of research projects and research experience with respect to the fluoride as well as cardiovascular disease. He is a renowned interventional cardiologist in this area, and he has done a lot of certificate courses, and he has conducted many workshops, and he has done oral presentations, publications, and many of the articles has been published in international peer-reviewed journals. And he is a member of many academic bodies. He has got a lot of research experience, as I mentioned. So with this brief introduction about this, and as I mentioned that fluorosis has got a lot of impact, and system-wise and the disease-wise every month we are conducting, and many of the participants have appreciated the program that we are conducting. We have conducted it on cancer, we have conducted it on diabetes mellitus, we have conducted it on renal linkage of fluoride. And this month's topic is related to the cardiovascular system, the cardiotoxicity and fluoride. And Dr. Lakshmaya, Yashwant Lakshmaya is working with this fluoride and its implication with cardiotoxicity. With this brief introduction, I request the organizing committee, Dr. Somya, to take over and proceed further. Thank you.
Thank you, sir. Now I request our Honorable Pro-Chancellor Dr. C.V. Raghuveer, sir, to kindly deliver presidential address on the present day topic, As Sir has got many research publications and Sir has guided many PGs and PhDs, I request you, Sir. Over to you.
Dr. Sashidhar, Vice Principal and Head of the Department of Biochemistry, other faculty in the Biochemistry Department, Yashwant, ladies and gentlemen. I'm indeed extremely happy today because fluoride is an ion which is close to my heart. So I might get heart disease also. Because fluoride is so close to my heart, it might cause heart disease also. Why I'm saying this is because I had guided or supervised 3 theses. One ICMR MBBS thesis, one MD thesis, MD pathology thesis, and one PhD thesis. PhD recently completed by Krishnaveni. In spite of all this, in spite of reading about fluoroid fluorosis in detail, I was sitting and wondering what to understand in today's webinar and whether I have understood anything at all after doing 3 theses in fluorosis. Because the last one, all the 3 theses which I supervised were concerning placenta. As you know very well, placenta is one organ which is discarded. You can do wonders with that organ. If you want to do thesis in other organs, you'll have to take biopsy or you'll have to take a small piece of tissue from that. Whereas placenta, the entire placenta is thrown. So you can collect that and then do wonders. That's exactly what we did. So preeclampsia, which is very rampant in Kolar. Kolar is in the fluorosis belt of Karnataka. 21% is the incidence of preeclampsia in this region. Can you believe it? 21% is a very high percentage. And what happens in this is fluoride sits in the placental circulation and prevents implantation of the placenta into the uterus properly. So there is a lot of production of certain markers, endoglins, placental inhibitory growth factor, and one more, three biomarkers are produced in excess. And if you catch all that and then estimate them, you can find out whether the patient is having fluorosis, whether the patient is having preeclampsia or not. When we did this, I told my PhD candidate, you try to find out whether there is any relationship between fluorosis and preeclampsia. She had done the 3 markers in the serum in preeclampsia patients without thinking of fluorosis. But when I told her, you think of fluorosis also because it is so rampant here, try to do fluoride also, and then find out whether it is high in this. It was very high. Fluoride was very high in all the preeclamptic patients, particularly those who came from Kolar region. There were patients from Kolar, there were patients from surrounding areas, there were some patients from Tamil Nadu also. So when we did the fluoride estimation, we found that in patients coming from Kolar region, it was very high. So it is obvious that there is some link between fluoride and preeclampsia. So further studies are required for this. We have only done an exploratory study where we found fluoride high in preeclampsia patients. We have to find out what exactly fluoride does in the placenta and how does it produce preeclampsia. So that I will leave it to you. Those of you who are young, who are still studying here, you can do again on placenta. Please note that you can do one more study on placenta because placenta is freely available. You don't need to go and buy, or it's not difficult to get. If you go to the labor room and talk to the labor ward sisters, they'll be able to give you. And you can talk to Dr. Sheila, who is the medical superintendent and former head of the department of OBG. You can talk to her. She will make arrangements for you to get the placenta. And with the placenta, you can do wonders. It's not at all easy to do that with heart. You can't get heart easily like that. Can you get it? You may get it when you fall in love, but not as an organ for research. Yashwant has done considerable work. I'm told I'm very happy about this young man. I had seen him earlier also. And I didn't know that he was a student of SDUMC. I didn't know that. I'm very happy to know that. And his father was a stalwart here. Some of you might have met him, but we were very close to him. Even today we are close to him. So with these few words, let me wish Yashwant all the best and all of you all the very best. Please carry on because I have to go back. There is a meeting which Vice Chancellor has called, so I'll have to go and help them out. Please pardon me. Thank you. Wish you all the best. I'm very happy. I'm not happy with the attendance, but at least those who are present in the department have come. Such a brilliant man has come to give a talk. You must have many more people to listen to him. You must propagate this. You must make it a habit that everybody comes and attends this webinar. So, for whose sake is it done? It's not done for. Pardon? Huh? Participants are there. Online. Huh? Oh, I see. Sorry, I'm sorry. I withdraw my statement. Wish you all the best. Wish you all the best. Thank you.
Thank you, sir. Thank you for your wonderful.
Okay. Online, am I audible? Okay, so good afternoon, everybody. It's been an honor and privilege for me to stand here in this forum and give talk in this forum, especially in my alumni institute and in front of my teachers. So first of all, as the sir told and our pro-chancellor also told, fluorine has been implicated in lot of health issues, whether it is starting from the bone or dental fluorosis or even the heart. And recently we have been also seen in young MI. So in our Kolar district, we are seeing lot of young patients coming with MI. And more so now the awareness has increased after few of the film stars expired. But actually we are seeing lot of young MI in our Kolar district. So there has been a link of this fluorine with the heart also. So let us see. But before going into the heart per se, I would like to tell about something about fluorosis, why it happens, and what makes it important. Because as such, patient sometimes will not present with cardiac problems. He may come with a dental fluorosis, but when we screen him for cardiac problem, we will find some kind of valvular heart disease. So going on, fluorine, as we know, it is the 13th most abundant naturally occurring element in the Earth's crust. So it is the lightest members of the halogen and it is most electronegative. So this fluorine actually it is released from lot of industries and even it is seen in the environment also. So most of the elemental fluorine does not occur in the nature but found as a fluoride material complexes. So fluorine is most reactive than most of other halogens such as chlorine, bromine and iodine. It is essential for mineralization of bones. So fluorine is essential for us, but at the same time, it has detrimental effects on the body also. So fluorine is essential for mineralization of bones as well as dental enamel formation. 96% of fluoride of body found in bones and teeth. That is the reason whenever the patient comes to us, more so they'll present with dental fluorosis or skeletal fluorosis. So all these years, what we thought is non-skeletal manifestations of fluorine is less, but now because the groundwater, the dependency on groundwater is increasing and the fluoride intake also is increasing. More so in Southeast Asian countries, we are finding lot of non-skeletal manifestations of fluorine also. So normally small amount of fluoride is required and it is there in our drinking water. What is the limit? 0.5 to 0.8 milligram per liter. So if you see the life cycle of this fluorine, so am I audible? So as you know, the fluorine is seen in the environment and it is there from the some of the materials, some of which is used in the industries. So what happens is it will be also seen in the plants also, especially in the tea leaves. So all this will enter groundwater through the feces or through the plants, and it will be in a groundwater as a residual. But in some part of the world, especially in the Southeast Asian countries, there is lot of fluorine in the groundwater. So like this, it enters our body. So fluorine, though I told it is very useful for us, especially for mineralization of bones, it is like a two-edged sword. Prolonged ingestion of fluoride through drinking water, especially in excess daily, more than excess daily requirement, it will lead to dental and skeletal fluorosis. But if it is only dental and skeletal, it's okay. But now we are seeing lot of extra skeletal manifestations also, whether it is stroke or MI or valvular heart disease. All these we are seeing, especially extraskeletal fluorosis. So similarly, inadequate intake of fluorine in drinking water is associated with dental caries. So as you know, this is a double-edged sword. Some amount of fluorine is required, but once it is excess, it will cause problem. So WHO has set a upper limit of fluoride concentration in drinking water of 1.5 milligram per liter. The Bureau of Indian Standards has therefore laid the Indian standards where the fluorine content is more. The maximum permissible limit of fluoride will further lesser the better, because if you take average in our India, the amount is more than 1.5. So especially wherever there is hard water, the concentration of fluorine is more. And in Kolar district, the hard water and fluorine incidence of the diseases related to fluorine is around 15 to 20%. So as you can see, there are different standards, whether it is Bureau of Indian Standards or ICMR, the desirable limit is 1. So if you go to WHO, it is 1.5, but when it comes to ICMR and BIS, it's lesser the better. That is 1 milligram per liter should be the actual content should be, of fluoride which should be available in the drinking water. But in South India, especially in Andhra and Karnataka, there is a lot of fluoride, almost going up to 10-15 times the normal. So what is fluorosis? So fluorosis is a public health problem. Is caused by excess intake of fluoride through drinking water or any food products or industrial emission over a long period, resulting in permanent and irreversible damages. The duration for the clinical manifestations to appear, it depends on the age, depends upon the amount of fluorine intake, and depends upon the quality and quantity of fluoride ingested. So what is the worldwide distribution? Worldwide, this fluorosis, it's we are thinking it's only in India or Southeast Asian countries. Unlikely, it is actually seen in almost endemic in 22 countries. So in Asia, India and China are worst affected. Mexico in north and northern and Argentina, especially in the Latin America, East and North Africa also are seeing lot of fluoride. So if you see this map, all the color which is in blue color are the areas where the fluorosis is ending. So that is the reason it is very important public health problem, especially in 24 countries, including India. So almost 85 million tons of fluoride deposits in earth crust, especially 12 million are found in India. Hence, it is natural that fluoride contamination is widespread, intensive and alarming in India. So fluorosis in India. Endemic fluorosis is prevalent in India since 1937. Almost 66 million people have been affected, and endemic fluorosis resulting from high fluoride concentration in groundwater is a public health problem in India, because lot of fluorosis. So available data suggests that almost 15 states in India are endemic for fluorosis, where the drinking water, I'm not talking about the groundwater which is used for cooking, I'm talking about the drinking water. Almost in 15 states in India, the content of fluoride is more than 1.5. And about 62 million people in India suffer from dental, skeletal and non-skeletal fluorosis. So why this is a public health problem is more and more children are affected, especially less than 14 years in their developmental age. So once the skeletal fluorosis occurs in children, the deformity is irreversible and it will become a more and more public health problem. So if you see, actually in Karnataka the level is 0.2 to 7.79, but there are a lot of other states, including few northern Indian states, where the levels of fluorine go up to 48, especially in Haryana, Delhi, Assam. So Karnataka is in between 0.2 to 7, almost 8 milligram per liter. And to remind you, the level should be less than 1 milligram per liter. So you are seeing the average, if you take in almost all the states in India, it is more than 5 to 6 milligram per liter. So especially Maharashtra, Andhra Pradesh, lot of states as almost up to 40 times. So if you can see this map, this is a little older map. In this map, as you can see, Andhra and Gujarat, Rajasthan are most affected, and Karnataka comes under 40 to 70% effect. The effect of fluoride is around 40 to 70% in the states which are light in color, and in those states, especially in Andhra, Gujarat and Haryana, so it is more, almost going up to 90%. So what is the source of this fluid? From where this source we are getting? So contaminated groundwater is the main source. Contaminated drinking and cooking water, agricultural and food products, drugs and industrial emissions and pollutions. So as you know, if we are staying in the tier 1 and tier 2 cities, most of the farming communities where they use the chemical fertilizers has lot of fluorine in it. So without their knowledge, it will be mixed with the ground soil, and from through soil it will percolate and it will increase in the groundwater. So without their knowledge, that is the reason now more and more organic farming is advised, especially in states where fluoride is more, because fluoride is seen in lot of chemical fertilizers. So what are the agent factors? So primarily it is fluoride which is present in drinking water. When fluoride in water is more than 1.5 milligram per liter, it is toxic to health. So if in 1 or 2 glasses, nothing will happen, but as we are consuming it for longer duration, the skeletal and dental fluorosis comes into picture. So calcium in the diet reduces the absorption of fluorine. So hard water rich in calcium reduces the fluorine toxicity. But what happens in the hard water is sometimes the calcium which is available in hard water will not be, it can't be utilized, especially when we are taking it for drinking. And fresh fruits and vitamin C reduces the effect of fluorine. So as we see, lot of agricultural population and lot of population from the villages are affected with fluorosis. That is because the decrease in intake of vitamin C rich foods in villages, at the same time dependency on the groundwater and lot of chemical fertilizer has been used. So all these factors will lead to fluorosis, especially in the tier 1, tier 2 and villages in our country. So school going children are seen with dental fluorosis. So dental fluorosis is one thing where we can use this dental fluorosis as a screening for school children. So I will be showing you few photos where we can see where we can screen for dental fluorosis. So if third and fourth decade, mostly children are, so how we should remember this is, so in children it is more common dental fluorosis. In third and fourth decade, second and 20s and 30s, it is more of skeletal fluorosis. Once passes by, then comes most of the non-skeletal affections of fluorosis. So what are the environmental factors? Low rainfall, low humidity, and fluorine rich in natural subsoil rocks. So in few of the subsoil rocks, fluorine will be very high. In such states, usually that is one of the environmental factor for fluorosis. And vegetables from high fluorine belt, even in the vegetables in high fluorine belt will have lot of fluorine. So and even the toothpaste what we use, sometimes it is fluorinated, and even that can lead to lot of fluorine intake. So going on to, after all these basics, moving on to types of fluorosis. So we have dental fluorosis, skeletal fluorosis and non-skeletal fluorosis. Why it is very important, though today's topic is more of cardiotoxicity, it is very important to know about dental and skeletal, because it helps us, because when the patient comes to us with some kind of symptom, it helps us in screening those patients and then checking for problems. So dental fluorosis, I'll be just showing the 3 photos. So this is the normal dental fluorosis, whereas in some endemic areas we see this kind of decreased enamelization of the dental. In very mild conditions, you can see the discoloration, whereas in severe cases, moderate to severe cases, you can see the effect, how it does to the dental system. So what it does is it erodes the enamel, and it is very easy to actually screen and very easy to identify such patients, especially when we screen for fluorosis. What about skeletal fluorosis? So skeletal fluorosis happens only if the intake is more than 3 milligram per liter. The fluorine content should be more than 3 milligram per liter, and it affects young as well as old, more so in the second and third decade. So this picture, what you're seeing, the victim of skeletal fluorosis, they come typically like this to our OPD, where stiffness of neck and spine. So if we screen for cardiac problem, they'll have some kind of valvular heart disease, mitral regurgitation or aortic regurgitation because of the fluorosis. So these are the different varieties, whether in children and adults. These are the diagrams where they come with skeletal fluorosis. So there are few tests what we can do, whether it is a coin test, chin test and stretch test. So what we should ask is, this is the pictorial representation. So we should place a coin on the ground and ask the patient to lift the coin. So usually they can't bend completely. The back can't be bent completely. So they will be unable to bend. So that is one test. And even stretch test, if they ask them to stretch their upper limbs, they are not able to stretch it completely. So these simple tests, actually it will be very useful for us in our OPDs to detect and then screen for cardiovascular problem. So types of skeletal fluorosis, just in one slide I have put mild fluorosis, moderate and severe fluorosis. In mild fluorosis, there will be osteosclerosis, generalized bone and joint pain. In moderate fluorosis, there will be calcification, stiffness and rigidity, whereas in severe fluorosis, it will be deformity of the spine and the limbs. What about coming on to non-skeletal fluorosis? So non-skeletal fluorosis has neurological manifestation, muscular manifestation, gastrointestinal and cardiac. So in neurological, lot of nervousness and depression, tingling sensation in fingers and toes, and excessive thirst and tendency to urinate frequently, similar to diabetic symptoms, comes in neurological manifestation. Whereas in muscular manifestation, muscle weakness and stiffness are seen, and in GI there will be bloated feeling, nausea, and even they have even told in some of the papers IBS, they'll present as irritable bowel syndrome. So what about if you see the gamut of involvement of fluorosis, starting from the teeth, bone is involved, even kidney is involved. We are seeing lot of CKD related to fluorine intake, and we are seeing lot of oxidative stress leading on to liver damage, and it is also implicated in non-alcoholic fatty liver disease, and even pancreas is affected, and we are seeing lot of insulin dependent diabetes presenting with fluorosis. And when it comes to cardiovascular, hypertension is one of the most common presentation, followed by carotid atherosclerosis and oxidative stress and endothelin factors leading on to heart failure also. So when it comes to cardiovascular effect, fluoride is known as a heart poison. So even Australia is affected. If you remember the world map which I showed you, where fluorine, even Australia, because it is surrounded by the sea water and lot of intake of sea, so lot of researches is going on in Australia. So if you so few of the papers they have suggested that coronary artery disease also is involved with fluorosis. So fluoride continuously accumulates in the human body over a lifetime, including the heart and the heart rates. The accumulation of fluoride involves microcalcification. The fluoride starts with calcification, as the main problem is calcification. So because it is directly involved in magnesium and calcium metabolism. So fluoridation is known to increase systolic blood pressure. So when the young patient, especially in the endemic area like Kolar, when they come with hypertension, we have to screen for other effects of fluorine also. So experiments on human also have shown that patients suffer with high rates of hospital admission, especially in congestive heart failure. So we will be treating with other kind of drugs, but we will sometimes forget to screen for fluorosis. So that is very important. Lifestyle modification is very important. I'll also be telling about a few slides about how to treat and mitigate the effects of fluorosis. So what is the mechanism of action? Actually, there is no one mechanism of action when it comes to fluoride. But fluoride has unfavorable interaction with metalloenzymes and magnesium metabolism. Magnesium is very important for heart, especially to maintain the proper rhythm of the heart. Whenever there is hypomagnesemia or hypokalemia, what happens is patient will present with lot of ventricular premature complexes. We have seen lot of patients even presenting with VT or VF, ventricular tachycardia. So magnesium is involved, and this fluoride has direct interaction with metalloenzymes and magnesium metabolism, and it also affects interleukin 6 and 8. So there are two things which we should keep in mind. One is acute fluorosis and chronic fluorosis. In acute fluorosis, where patient comes with ingestion of some kind of fertilizer or some kind of industrial material where it causes acute fluorosis, even there we have seen lot of VT, VF, arrhythmias leading because of hypocalcemia. Whereas in chronic fluorosis, these three things: dental, skeletal and non-skeletal. So children with dental fluorosis, they have taken 100 children in this one of the studies, and they have screened. Children had only dental fluorosis. They didn't have any cardiovascular problem. So they took 100 children who had dental fluorosis, and they have screened, and they have find lot of ECG abnormality, especially prolonged QT interval, and that is one of the biomarker for arrhythmias, that prolonged QT interval. So they have seen, and it is also a risk factor of sudden cardiac death. So we have seen a lot of young patients. Now we are doing one study in young patients and implicating fluorine, especially in young patients. So chronic exposure of fluoride has seen to increase fluoride deposition in lot of tissues. Tissues, when I tell cardiovascular per se, it is mainly heart and the aorta. So what happens is aorta becomes stiff once the fluorine starts accumulating in the aorta. The stiff aorta lead to increased in BP, that is hypertension, increased risk of stroke, heart attack and even heart failure. And there has been implication of aortic aneurysms also in fluorosis. So how to mitigate fluorosis? So one is closing contaminated water source, which is very important. But when it comes to groundwater, it is very difficult for us because already our most of the districts are barren districts, and they will automatically depend on the groundwater. So closing contaminated water source is one way of mitigation, and arranging alternative source also is very important. So sedimentation, flocculation, sedimentation and coagulation with lime and alum. This is a simple technique which can be used in our household. So that has to be done, and health education and dietary counseling is very important. So there are few studies which is proven that diet which is rich in calcium, vitamin C, vitamin D and iron. So if you are eating healthy source of fruits per day, vegetables per day, take a good quantity of calcium in our diet, automatically the fluorosis will be mitigated. So that is one thing which health lifestyle modification has to be done. So it is very important for us to detect early rather than catching the patient when a patient has already have a lot of valvular disease. Whenever we see a patient with some kind of dental fluorosis or some kind of skeletal abnormality, screen such patients by doing a simple ECG and echocardiogram to see the effect of fluorosis on the heart. So rain and surface water harvesting for agriculture and household is very important rather than depending upon the groundwater, and supply of pipeline river water from water treatment plant. That is also one thing what we can do. So what are the do's and don'ts in relation to nutrition intervention in fluorosis? So the don'ts are black tea. So what happens is now when it comes to recent pandemic and recent all this, now we are used to drinking lot of green tea, black tea. So even in black tea, the tea per se has lot of fluorine intake. Even in the non-fluoride endemic, the tea leaves, even though if it comes from the non-fluoride, tea leaves has lot of fluoride in it, tea per se. So when we are taking, it should be always limited to 1 or 2 cups per day. That doesn't mean we can have 4 or 5, 6 cups of black teas per day, which lead to fluorosis. And even the black salt, rock salt, also has lot of fluorine in it. So it should be used in moderation. And tobacco also has fluorine. And tobacco, supari and fluorinated toothpaste, all this has fluorine. Without our knowledge, we will be taking that inside. So what are the do's? We should have calcium rich food, vitamin C rich food and iron rich food, that is green leafy vegetables and milk products and citrus fruits. But when we are ingesting these foods, especially grown with chemical fertilizers, again we have to be little careful. So fluoride also, just to put black or lemon tea, so that should be, not that we should not have, it should be in moderation. And canned fish, especially this canned food, canned non-vegetarian food, has lot of salt as well as fluoride in it. So we have to, and the chana dal what we regularly use in our meals also has to be, because we have seen few of the patients, especially in northern India, where they consume daily in day-to-day basis, and we see a lot of fluorine in such patients. So what is the treatment of fluorosis? We have medical treatment. In medical treatment, there is no specific product which can go inhibit the effect of fluorosis. It has to be the supplementation, antioxidants, calcium and vitamin C rich foods. And for the deformities, yes, we have to give supportive therapy, whether it is reconstructive surgery, physiotherapy or surgical shoes like that. And what is the medical management? So early detection is very important. Once there is early detection, we can screen such patients, and we should do a lifestyle modification in such patients. So why it is very important medical management? Because once the patient comes late, especially with cardiotoxicity or cardiac effects, patient already has heart failure, it is very difficult to treat, and the patient becomes burden both for the family and also for the medic, because we don't have complete proper treatment, especially for fluorosis. So screening them early is very important. So what are the guidelines for surveillance? This is very important. So permissible limit of fluoride in drinking water, as we all know, it's 1 mg per liter, that is 1 ppm in drinking water. The magnitude of fluorosis problem in endemic area should be assessed properly, and it has to be notified, because it is a notifiable problem. It has to be notified for the district authority. So when it comes to the dental fluorosis, this is just to how to screen. I'm telling how to screen. So one is, we have to suspect whenever there is dental fluorosis, any yellowish or brownish discoloration or decrease in the enamel surface on the teeth, and that has to be kept in mind. And second, skeletal fluorosis should be kept in mind whenever the patient comes with persistent pain, whether it is bony pains or some sort of knock knee or bow leg, inability to squat. So such things we have to keep in mind. And in non-skeletal, when patient comes with, as I told you, breathlessness or nervousness or all this simple, it may be a simple complaint, but we have to keep all this in mind, and we have to how to confirm it. So any suspect case of one or both the following, that is, if you are suspecting a case, we have to collect the urine and we have to test for the fluoride. If the high level of fluoride in urine, that is more than 1 milligram, that has to be kept in mind. And even we can see the intraosseous membrane calcification, because we don't have one test in, especially when it comes to heart, cardiovascular, we don't have one test to diagnose fluorosis. We have to depend on the skeletal. So sample collection is very important. 30 ml of spot urine sample has to be collected, especially not in the glass bottle, because the test what is done is the toluene test. 1 to 2 drops of toluene is used on the urine samples to make a complete layer. And similarly, 30 ml of water sample should be collected from the source where the patient is taking drinking water. So urine and the water from their house, that is the sample collection. So last few slides I have told about the surveillance. So transportation, actually what is the most important is water samples can be kept in room temperature at district laboratory, and it should be analyzed immediately. So urine should be stored in refrigerator if it is, and ion meter is used for the analysis. So at the end, summarizing everything, what I want to tell you is, fluorosis is one of the most important thing what we should keep in mind when we are treating, whether it is dental fluorosis, skeletal fluorosis or non-skeletal fluorosis. So why it is very important is, at least doubting when the patient comes to our OPD, we should keep this in mind and at least screen for them for us to detect cardiovascular problem. Yes, it is implicated in hypertension, which is very common, to even cardiovascular heart disease, MI. So it is all the starting from hypertension, which is easily treatable, to the valvular heart disease and heart failure, which is very difficult to treat. So this is the implication of fluorine, and we have to keep in mind, and we have to screen the patient properly, and we should diagnose and then treat accordingly. So any questions I'll be taking?
Thank you, sir, for your exemplary talk. Now the forum is open for the discussion. Any queries can be posted in the chat box, which will be addressed appropriately. Over to you, sir.
I think it will pop up.
Maybe it's not.
No, host has to turn on.
You're getting the message.
Okay.
Sir, out of time.
Yeah.
Thank you, sir. Now I request me, madam, to propose vote of thanks. Please, ma'am.
Good evening, one and all. I take this opportunity to propose vote of thanks on behalf of Department of Biochemistry, Sri Devaraja's Medical College. First and foremost, we salute our late founder, President Sri R.L. Jalapaji, who continues to be a beacon of light. We would like to thank our patrons of Sri Devaraja's Educational Trust, Honorable President Sri G.H. Nagaraja, Honorable Vice President Sri Rajendra, Honorable Secretary Sri Hanumantaraju, Honorable Chancellor of Sri Devaraja's Academy of Higher Education and Research Sri G.H. Nagaraja, Honorable Pro Chancellor Dr. C.V. Raghavi, and Honorable Chancellor Dr. Pradeep Kumar, Registrar Dr. D.V.N. Prasad, Dean Faculty of Medicine Dr. Sriramalu, Dean Allied Health and Basic Sciences Dr. C.D. Dayanand, Medical Superintendent Dr. Sheila Ma'am, and Vice Principal Dr. Shashidhar K. Sir. I also extend my thanks to other officers of the Academy. I thank Dr. Sriramalu Sir, Principal SDMC, for his unceasing support and encouragement. I thank distinguished luminary and alumnus of SDMC, Dr. Yashwant Lakshmaya, Consultant Interventional Cardiologist R.L. Jalapma, Narayana Heart Center, Kolar, for accepting our invitation as speaker and delivering an insightful presentation. Thank you, sir. I thank all the faculty members and stakeholders of SDHF for their enthusiastic participation in the event. Last but not least, I thank the non-teaching staff, photographer, and technical team members who are part of this program. Thank you, one and all.